Hello, for my project, I will be talking about optimizing inventory control to create accurate count levels at St. Thomas, Rutherford. The type of project that I chose is the second option, the process improvement study using DMAIC. This will help me understand inventory control regarding product requests outside of the daily orders that clerks do bring and stock up on the floors. I chose this project because I have seen firsthand the effect of inventory levels being insufficient and how it disrupts patient care. When there's a lack of product, it can delay treatment plans as far as patient care and ultimately affect their recovery time. For the resources that I'll be finding my information, I'll be using historical inventory data that we have within our systems. This will include inventory days of supply, inventory turnover, inventory velocity, as well as our forecast accuracy. I will also be going to my operations manager to kind of get a insight as far as the cost of borrowing a product from other hospitals and also the cost of ordering expedited services to be able to deliver products. We also do substitutes, and I kind of want to get his insight as far as any additional information on the risk that comes with that, and if there's any waste with any of these additional services to be able to fulfill inventories. I also want to be able to have an insight into the perspective of the other MMD staffing and what they see as the problem with as far as inventory control processes in our department. Sometimes receiving other perspectives will help me understand where they see that there's inaccuracies as far as what we're doing and if they possibly need more resources to be able to adequately do their job the first time. I also want to do a little bit of research as far as inventory control and the issues that may come with manual, perpetual, and periodic inventory systems. We use a little bit of both in our department. I'm not. I just need to look a little more into it and want to find continual improvement methodologies as far as inventory control. There has been a consistent imbalance when it comes to inventory fulfillment levels and inventory accuracy. That is the overall problem that we have. I feel like some of the reasoning behind the problem may be because our staffing may not remember to charge out items, or maybe they're charging out the wrong items. I also find that there has been some hospital staff, clinical and non-clinical personnel, that will come into the storeroom and kind of take inventory without signing them out in an organized manner. And as far as that being, is their sign out legible to where we can understand what they actually signed out? Are they using the correct product name, or is it a nickname? There's a whole bunch of different aspects that comes into signing out manually, and I feel like that it also creates a lot of risk. And so I want to find a way that we can manage these risks in a controlled way. So the objectives for my project will identify an improvement method or methods that will maintain more accurate inventory counts. I think I want to also invest a little bit more time and effort into the manual area of inventory systems. I feel like that's probably where our downfall is the most. I want to create a more viable inventory control by using visibility as more of a standard. I find that maybe barcodes and or color coordination as far as inventory labeling would probably be more beneficial to maintain a more visual status on inventory control. My timeline for this project would be the topic proposal being January 1st, 2022. The paper outline being February 22nd, 2022. A progress report on March 15th, 2022. Rough draft will be done April 12th, 2022. A written project would be May 5th, 2022, as well as the project presentation. I'm hoping that everything will go smoothly. I might run into obstacles as far as staffing not willing to share their ideas or inaccurate data from historical inventory reports that might delay my project. I find that it could also affect the overall result of my project. So I want to make sure that the inventory management models and reports are credible from our past inventories. Thank you.